Hey everybody, this is Dr. Whiting, and welcome to Part 3 of Cheating Death 2022. We left you off with a discussion of heart disease, the #1 cause of death, and hopefully a lot to think about. Well, now we're going to talk about something that you may or may not be aware of. Candida albicans, which is a naturally occurring organism in every human being's intestines, can be problematic if it overgrows. And once it overgrows, then it can be a much more serious situation. As long as the Candida albicans organism is confined to your intestinal tract, life goes on pretty much normally. But if it starts to overgrow, then we have some problems. Causes of Candida overgrowth are prolonged use of antibiotics. And doctors are very fond of using antibiotics for, a stub toe. They're given routinely, as they say, just as a precaution. Well, unfortunately, antibiotics are very powerful. They're very beneficial when needed, but they are not good when abused, because not only do they cause biochemical disturbances internally, but you can become immune to them, and then when and if you actually need them, you have a problem. Use of birth control pills in women. Birth control medications alter the beneficial bacteria in your small intestine and especially in your colon. Use of steroid drugs, especially on a prolonged basis. Severely depressed immune system, and loss of gut lining integrity, which can come if you develop things like colitis, Crohn's, etc. All of these things can cause an exponential overgrowth of Candida organism. And when it becomes systemic, so the overgrowth can occur and can break free from the colon and enter the bloodstream. And when Candida becomes systemic, it can create a whole lot of problems. Common sites of external, out of the colon. Common sites would include your lungs, so it compromises breathing, sinuses, repeated sinus infections, issues with your digestion, and even your brain in the way of thinking and in the way of memory. So let's look at some of the symptoms of Candida and systemic candidiasis when it's excessive, and see if any of this fits for you. Fatigue, lethargy, loss of energy, poor memory, feeling spacey, out of touch, like you got a bubble around your head. Depression, burning, tingling of the hands and feet, muscle weaknesses, muscle aches, abdominal pain, constipation or diarrhea, or both, going back and forth, bloating, in women an odorous vaginal discharge, vaginal itching and burning, a loss of libido in both men and women, premenstrual symptoms that become excessive, blurred or erratic vision, oral rash and blisters, nasal, ear itching, irritation, and in men, prostatitis. What's the standard medical treatment for this condition? Well, obviously, like we said in Part 1, when you go to your doctor, the first thing they're going to reach for is the prescription pad. And unfortunately, most prescription drugs only work in the intestinal tract and are not effective once the yeast overgrowth has gotten out of there and become systemic. Then we have the more holistic approach, which is diet. The now infamous Candida diet, which unfortunately is completely worthless in eliminating candida once it becomes systemic. It only lessens the symptoms. If you follow the strict candida diet, which is no carbohydrates, no fruits, etc., you'll feel better. There's no doubt. But the day you go off that diet, your candida symptoms, I guarantee you, will return with a vengeance. Because all that diet is doing is suppressing the symptoms. It is not addressing or eliminating the problem. Then we have many herbal products on the market, but they are primarily, once again, effective only when the candida overgrowth is confined to the intestines. Preventing and reversing candidiasis. First of all, we destroy the candida systemically with buffered oral oxygen. And there are oral oxygen supplements that you can use safely and effectively, which will increase the oxygen level of your blood and soft tissues. And since the candida organism is primarily anaerobic in nature, it cannot tolerate repeated elevations of oxygen, and it eventually dies. Once that occurs, we then reimplant the healthy bacteria in the colon, and we use a multi-source acidophilus or probiotic formula. Then often we choose to boost the immune system with nutrients such as ester C, zinc, colostrum, beta-1, 3D-glucan, echinacea astragalus, pau d'arco, and a mushroom biomass. This combination works very well in boosting and nourishing the immune system. Then we do our darndest to get you on a diet of fresh whole foods and to take a full spectrum multivitamin mineral product on a daily basis to ensure you're getting the 100+ nutrients you need for optimal health and wellness. This is Dr. Whiting. When we return, we're going to talk about stress, the cardinal cause of all disease and disorder in your body. Stay tuned.